Welcome to the Nutritional and Herbal Medicine mini class. My name is Tal and I'm the Educational Director at the American Academy of Functional Health. In this mini class, as part of our Functional Medicine series, we're going to be talking about the role of nutritional medicine and how we can use some nutritional medicine strategies to help our patients to improve their health and improve their function and mitigate some of those chronic symptoms that they might be struggling with. Now, you might be asking yourself, why would that be important for me? If I'm a healthcare practitioner or a primary care provider, for example, why would that be important for me to learn and communicate about nutrition and herbal medicine? Well, here are the two main reasons why every healthcare practitioner should know about nutritional and herbal medicine. The first one is your patient's dietary choices can drive inflammation and oxidative stress, impact their metabolism and hormones, as well as influence the expression of their genes. So your patient's dietary choices and lifestyle choices could be the difference between a patient who is continuously improving their health or a patient that is continuing down the disease pathway or develop complications or other symptoms. And so as healthcare providers, we really need to have a good understanding of this topic and provide the guidance when appropriate. The second reason is because statistically in 2012, about 52% of the adult population in the US reported taking supplements. And that increased significantly in 2017 report to about 7 out of 10 adults. We believe today that it's a little bit higher, probably about 8 out of 10 adults in the last 2 or 3 years that are taking supplements. And if you, as their healthcare practitioner, don't give them the guidance and recommendations in regards to which supplement to take and which not, they're either going to pay somebody else to get that advice, or most commonly, they're going to do what most patients do, and that's go home, ask Dr. Google, and self-prescribe, which means that they're taking supplements that might not be appropriate, beneficial, and in some cases could be harmful for them. So we prefer to teach you this topic and for you to be able to provide them with evidence-based guidance to what would be more beneficial for them to take. Now, this is the interesting part about nutritional medicine. As we know, many of the healthy processes, such as energy production in our cells, the formation of hormones, and metabolism of glucose and fats, require specific nutrients, such as B vitamins. Here's just an example of some of the B vitamins and how they play a role in biochemical processes such as antioxidants, the Krebs cycles in the mitochondria, hormone synthesis, and there are many more processes such as those. So here you can see an example of the importance of nutrients in the prevention of atherosclerosis. Both vitamin E, niacin, and vitamin D play an important role in regulating the function of the immune system and in reducing inflammation, which is one of the major contributors to atherosclerosis, the building of that plaque in the arteries. And so you can also see that niacin supplements on the right side can also increases the amount of HDL, which is the good cholesterol, which is associated in reduction of cardiovascular diseases. Now, this is one snapshot from the whole picture, and you can see there are multiple and specific different nutritional compounds or herbal compounds that could be very beneficial in reducing the risk for development of atherosclerosis. Here are additional examples of how clinical nutrition could be useful for chronic patients. Quercetin at a dose of 500 milligrams per day was reported to significantly reduce levels of C-reactive proteins in patients with CRP below 3. Another interesting study reported that red yeast rice extract inhibits the endogenous production of cholesterol and is reported in multiple studies to significantly reduce serum levels of total cholesterol, LDL, triglycerides, and HSC-reactive protein. Just a simple strategy. Typical dosage ranges between 1200 to 4800 milligrams per day, and some studies even compared it to statin medication and were found to be very beneficial for those patients with high triglycerides, LDL, high cholesterol. Another interesting study reported curcumin extract when administered to a group of patients, adult patients with primary knee osteoarthritis with pain score of 5 or above. They reported that 1500 milligrams per day was as effective in reduction of pain and inflammation as 1200 milligrams of ibuprofen. The group that received the curcumin had significantly less amount of GI side effects, which is a known negative impact or side effect of the NSAIDs medication. So again, these are just a few examples of how one simple strategy or recommendation could be very beneficial for those patients who are struggling with those conditions such as high cholesterol, chronic pain, joint pain, or inflammatory conditions with elevated C-reactive protein. Here are the citations for those particular studies. And here's one of our graduates, Jacqueline, a highly sought-after holistic health and wellness nursing coach who owns her private practice and helps patients to achieve optimal health. Jacqueline was nominated and honored with the Top 100 Nurses Award in the US and for her contribution to the art and science of nursing and to patient care. And this is just an example of one of our graduates who are doing amazing work to offer a comprehensive approach to their patients. And so if you're interested in learning about the root cause of chronic diseases, gaining new skills, and offering comprehensive care to your patients, then I invite you to check out our Advanced Functional and Nutritional Medicine program. We focus on the clinical application, and the program is comprehensive, self-paced, and online, which means that you can study from anywhere. We also include a variety of specialty classes, treating autoimmune, women's health, men's health, chronic pain, metabolic, cardiovascular, genomics, talking about functional pediatrics. We got a variety of topics for pretty much almost any chronic condition out there to equip you with the knowledge and the tools to help your patients. I invite you to reach out to us to schedule a call with an admission advisor, and I appreciate you being here, watching this video, growing your skills, and offering comprehensive approach to your patient. I wish you the best of health, and I'll see you in the next class.